So I'm currently in the med school application process, and I'm really grateful that I've had one acceptance so far and two wait lists. And all three of those interviews happen to be MMIs, which stand for multiple mini interviews. So I wanted to talk a little bit about my experience doing the multiple mini interviews and how I prepared and what I think is most helpful to know going into the multiple mini interview. So I'm not exactly sure on the statistics of like how many schools do MMIs versus normal interviews, but I do know that tons of schools are implementing MMIs into their interview day more and more. The multiple mini interview is basically what it sounds like. You're going to be talking to maybe 10 different interviewers on your interview day. And the way that that's structured is like, in the case of Zoom, which all of my interviews were on Zoom, you go to the first interviewer, they show the prompt to you on the screen or they type it in the chat, and you have 2 minutes to think about the prompt and how you're going to structure your answer. And then you have like 6 to 8 minutes to just talk with them about how you would approach the situation. And if there's extra time, you can, I guess, talk about other things too. Or they will ask you follow-up questions. The three main buckets of questions that I've encountered in my interviews and what I've seen online are the ethical scenarios, the personal scenarios, and then like the more lighthearted questions that don't really have to do with any scenarios. So the ethical scenarios are usually the most daunting and like hardest ones to prepare because they'll sometimes throw you some curveballs. Like basically they present you an ethical scenario and you have to present like exactly how you would deal with it, give some like contingency plans, like if this person does this, then I'll do this, but if they do that, then I'll do this. And a lot of times, or in my experience, when I presented those contingency plans, they would be like, okay, so then what if they do this? And then you would have to think on the spot, like, okay, how would I respond to this scenario? The most important thing for me going into these MMIs was having a really solid foundation of bioethics and all of the different kinds of scenarios that you could be presented as a physician. I took a class in undergrad called Foundations of Bioethics, where the professor would walk us through clinical cases and the decisions that he ultimately had to help them make. It was a really good foundation to have going into preparing for the MMIs because we had to write a bunch of essays about the different case scenarios, and I still remember a lot of the cases he talked about. So